I've gone over how the pelvic floor moves. Now, what about strength? What about Kegels? What is up with that? So let's just bring this back to like the 1950s when our Dr. Arnold Kegel studied Kegels. So he was a person, he's a gynecologist. He looked at women and, you look up the original study, but basically it said, okay, if people have leakage, pelvic floor contractions are good. That's kind of it. And when he did this study, he was one-on-one with his patients, and the Kegel was being measured. So like how much the pelvic floor contraction was being measured. Circle back to today, 2022, what is Kegels? Just, oh, squeeze your vagina is what I hear people say. Okay, little bit of a problem because Kegels are not often done correctly. So number one. Number two, there are so many types of pelvic floor contractions. There's quick ones, there's endurance ones, there's elevator Kegels, there's eccentric Kegels, which are lengthening Kegels. And believe it or not, if you have incontinence, a strengthening Kegel, which I always say is like I call it the classic Kegel, which is squeeze and lift, may not be appropriate because you might need to lengthen first. Those muscle fibers, those scar tissues may be so tight that they're not getting a good squeeze because they need to relax and open first. So flip side, more of a candidate from my perspective, me to investigate if manual therapy is indicated, if people need to use tools to stretch the fibers, if they need to do lengthening Kegels. These are all important things that I discuss with people on a first visit because there's just this big, if you're leaking, squeeze it, which is not true. It actually can make a problem worse. Wow. So that being said,